Welcome again to the Active Health Podcast, where we talk all things health, fitness, and performance, and we believe in taking an active role in your health. Today is going to be a fun episode where you can see behind me, I'm the audio guy today, and we have our case manager, Lynn, talking to one of our most successful outcome patients and one of our favorite patients just because he's so fun to be around. It's going to be a great conversation about how he interacted with us with his joint pain and his process and everything. I hope you enjoy this time with Lynn and Mike.
Cool. Well, thanks, Dr. Josh. As he said, Mike has been one of our most enjoyable patients, and I think what makes him so enjoyable is he's awesome to be around, but also he was very forthcoming with the treatment that we were able to offer. So now we kind of want to hear from Mike. Tell us a little bit about you and kind of what led you to Active Health Clinics.
So I've been a career farmer where you abuse your knees, a lot of knee work, abuse your knees every day. Didn't do a lot of sports, but some. And as most people age, they, start headed down that road of arthritis or osteoarthritis, and which I did, and kind of toughed it out for several years. And then I tore my meniscus 5 years ago, had it repaired, limited improvement from that. And I was just exploring alternatives to knee replacement. And my son, who's hooked up with Active Health, encouraged me to stop by for a very reasonable fee, the x-ray and the evaluation and consultation to determine whether you're a candidate for stem cell.
So what kind of led you down that path? I know you coming into the office, you met with us and, we gave you our treatment options for you. What made you think that was the right option for you opposed to a joint replacement?
Well, I think my goal was, and still is, to push this joint replacement thing back a few years. I'm still pretty active. A lot of people that have had the joint replacement have their own personal struggles with that, which I kind of wanted to avoid at this point in my life.
Yeah, absolutely. So after you agreed to proceed, tell me about your time in the clinic. What did you like? If there's anything you didn't like, just tell me about your experience within the clinic.
Very caring and knowledgeable staff, wonderful people. Always there to help me and encourage me through this process because it is a huge commitment. Mm-hmm. And you got to get that in your head before you start down this road. And it's a kind of a three-pronged thing with the light therapy, the pulse therapy, and of course the physical therapy, which Kanan's an ace at. So I'm most satisfied with the results, and I'm only going to be 4 months down the road with it. So small improvements every month with almost zero pain now, and some discomfort occasionally. You kind of need to listen to your body. If you're making a movement that seems to irritate that joint, probably should avoid it for a while.
Yeah, so you kind of talked about recovery. So how do you, now that you're outside of Active Health Clinics, how do you track your progress?
Oh, just daily, you can tell.
Yeah. I know a couple times you mentioned when I step out of the truck, I can't feel it ananymore. So that's
yes,
great.
Yes.
That's awesome. That's what we like to hear.
I always seem to respond and feel better in the heat. Mm-hmm. I have great joint days. My joints are always somewhat affected by low pressure systems. I can feel it kind of in the knees when we have an approaching low pressure system or something. I think that's very common. Yeah. So, I don't know.
Cool. So one of the things that I wanted to talk about is regen is not a magic. It's not magic, mm-hmm. but you were able to commit to the process. Mm-hmm. And how do you see yourself still committing to the process outside of Active Health?
Well, I think I probably need to get in and work with Kanan a little more on the physical therapy and see if my range of motion is still where it should be. Yeah. Always important to remember when you have joint pain that maybe there's something else contributing, like maybe some dehydration or something. Mm-hmm. Water, a very important part of this.
Yeah. Yeah, absolutely. So how do you think, I know you've praised Kanan in the past, how do you think when you started treatment, how did you feel when you finished treatment with Kanan? Like what were some key moments while you were working with Kanan that you felt different or you felt you could move differently?
You can almost tell your knees just feel stronger when you're finished with a session. And I mean, he's really good at encouraging you to keep it up, and did the same thing. I followed his instructions at home, big part of that. So yeah, it's just I feel like we've had true success with this process.
Cool. So a couple of things, like what would you say to somebody similar to you, either with age or demographics or anything like that, that would consider, why would you tell somebody to consider this over?
I would tell them that anyone that is considering an alternative to joint replacement to stop by and see the people at Active Health and get for a very reasonable price, you can get an evaluation to see if you're a candidate.
Cool.
So that was a great conversation between Mike and Lynn there. Well, what stuck out to me, and I hope all of you heard something that resonated with you, but what I heard is Mike was definitely looking for an alternative. He's a guy that wants to continue to enjoy living his life and moving, but he didn't want to go down that knee replacement option yet. Unfortunately, that's so commonly the only option people are given. Is he had the previous surgery, he got minimal relief with it, was still struggling with some pain, but then again, probably the next option he was going to be given was just the joint replacement, and that wasn't in his cards or wasn't what he was looking for. He had talked to other people that had the joint replacement, and their results were mixed. You know, the different people have different results, so he wanted the different option. And what we love about patients like Mike is he understood that it was going to take some work on his part. He understood that it wasn't just going to come in and we were going to fix him. He understood that he had some responsibilities in his treatment plan, and he was dedicated to doing his rehab with Kanan, and he's still staying active to this day and does things like staying hydrated. So if hopefully some part of this story resonated with you, and if there's something that we can do for you at Active Health, please let us know, whether it's commenting on this video, whether you're seeing this video on Instagram or YouTube, but we're here to help patients in our areas have another option. So again, I hope you've enjoyed this episode of the Active Health Podcast. Hope to see you again on the next episode.